internal medicine, which is, both of these are ways to help the people by being a general practitioner, you see. And they want to be in these surgical fields, all kinds of surgery, chest surgery, open heart surgery, you know, that you read about. It's very attractive. You're on TV, these fields. And then, do you remember who works in a hospital for Monday? There's certain doctors that work in a hospital and you don't know them.
Oh, lab technician.
Now, wait, now you're coming close. The lab tech. Boy, you people know it. I wish the middle class knew it as much as you do. Okay. Pathologist, who else?
X-ray technician.
All right, radiologist. And the last is anesthesiologist. They work in hospitals. And again, you're safe if you say that's connected with it. That's right. How much does an X-ray doctor whom you never make in West Virginia? Do you have any idea? I'm in the business. Huh?
I don't know.
All right, yeah. You've got it about right. Except for maybe somebody up at the med center. I don't know of any of them that make less than this, and I do know of some that make this kind of money in thousands. M means thousands. See, the idealist now is really up there to where you have changed the world. Now remember, is he worth this? In social terms. Now, this man's reading an X-ray, right? Well, let's not have our own opinions. Let's listen to Dr. John Knowles. You ever heard of him? Where did you ever hear of him?
In the paper.
Yeah, he's been in the paper recently. Yeah. Secretary Finch appointed him to head the health services in this country. And President Nixon was beholden not to Dr. Knowles as a doctor or because he had supported President Nixon, which he had, but to the AMA, who had put up a great deal of money. You remember in the campaign? So that he didn't get the job. But Dr. John Knowles is a very big man. He is the head of the most prestigeful hospital in the United States, Massachusetts General Hospital in Boston. Dr. Knowles says that the three kinds of doctors we just listed, in his experience, are usually the least inspired and mostly the bottom of their class. That's talking about the radiologists, the pathologists, but they are after the dollar. And they go into these fields. Now, that's not a very nice thing to say. See, doctors don't usually talk about each other. That's part of the reason you have the problems that remember you discussed earlier. They not only don't talk about each other, they talk about building trades having a closed shop, but they really got it closed off, right? So that it's very seldom that the shade is pulled aside and we have any idea of what's going on. Not the slightest idea of what's going on, right? I mean, I'm not very popular for telling about it with the people I work with every day. Nobody is who's on the inside. Nobody wants to admit there's malpractice, right? Well, and how could you have the College of the American College of Surgeons executive director say that, do you remember on Monday, what percentage of all American surgery is unnecessary?
25%.
Yeah. At least 25%. He's no dummy, you know. He's a board-certified surgeon. He heads the organization. He knows what's going on in these hospitals. Now, if you're doing unnecessary surgery, you're cutting a person who shouldn't be cut. There's several things morally wrong with this, aren't there? Not legally. First of all, suppose your little boy, 17, cuts somebody. Is this a joke? Huh? It's a crime. It's a crime, right? Only the doctor is exempt from the laws that govern us. And he must be helping a person. Now, he must have the right to go in there if he thinks your appendix, you know what I mean, is about to burst or is in bad shape, even though later it's shown that it wasn't bad tissue. You see what I mean? But he still had that right because he's trying to help you. Now, what do you think about fooling around with children's tonsils and adenoids when, remember we talked about this on Monday, is every child that goes on to the operating room table going to get off of it?
No, they don't.
All right. What do you think about doctors who schedule at Claremont General Hospital Saturday morning T&As? See those words? See, these are words, it's like doctors writing Latin. They know about as much Latin as you do, but they're taught to put the prescription in other language, okay? Yeah, keep it a secret, just like witch doctors in Africa or in Asia, anywhere else. So they got T&As now, Saturday morning. And they're called elective T&As. What do you think about that? In other words, three in a family sometimes. Now, whatever decided that three of them had tonsils that were so serious that you risked the child's life? What? Huh? I wonder how you know so much. That's right. That had to be something, right? Now, having given such a brutal business, if you poor people are going to understand what's really going on, what are our needs? More women here than there are men. Do you have any idea the name of the doctor that specializes in women? What? Oh, a gynecologist. And then he does something else, so we put a dash. He does two things. You could call it gynecology, but the part of delivering a woman, of a baby. Obstetrician. Okay. So the field, the specialist is OBGYN. Okay? This is a real specialty field. Like a doctor learns internal medicine, he must learn this. He takes years of residency, at least 3 years of additional residency. Now, this OBGYN doctor, do we have any in Marion County? Now, wait a minute now. Let's talk about it. Huh? We have doctors who practice in this field?
More than that.
All right. Now, there's a lady who says Dr. Moore. Well, I'm just putting it up here. Anyone else? Come on. Dr. Cord. Okay. Come on. Let's get them out. Huh? Dr. Evans. Okay. You want to know, don't you? Or you really want to learn about the field. Any more guesses? You name them. That's all right. That's all right. Now let's talk about something a minute. On Monday, what'd we say? What is the licensed law in the state of West Virginia? What is a doctor licensed to practice? Obstetrics? No, what is he licensed to practice? Medicine. Right. The state turns him loose, licensed to practice medicine. Now, legally, if he takes the exam this month, which is the annual examination, he gets licensed to practice medicine, and he hangs out a sign. Suppose the boy went to WVU 4 years. He finished, he got his MD, he took a 1-year internship to give him some experience, like an apprentice, right? He would be what we'd call a GP, wouldn't we? He's sort of just ready. Right at the clinic is a superb young man like this, Dr. Tallman, graduated from West Virginia University, took a 1-year internship, went to the Army for 2 years as a GP, and came to the clinic and practices as a GP, right? General practitioner. He hasn't had any specialty training. Suppose, though, a guy finished this and he wants to hang out a sign that says brain surgeon. Anything illegal?
No.
Very interesting, isn't it? Not a thing in the world. Suppose he wants to hang out a sign, OBGYN. Huh? I'll leave these names up here. How about if he wants to hang out a sign, OBGYN? That's all right, isn't it? So that what we've learned is a doctor proclaims himself. You understand? All they've done is license him. They turned him loose, right? They made sure he had an MD and an internship. They didn't guarantee you that if your brain's going to be operated on or he's going to take out your appendix that he was trained to take out an appendix. They don't even guarantee you that he had 1 minute's time on a surgical service after he got his MD, that he even assisted. Okay, that's the license law. What kind of protection? Well, wait a minute, let's get back to Marion County. Here are women in this room. You need this field. Well, let's talk about another county. Let's talk about Harrison County. Anybody down there in this field? Yes.
Harrison?
Yeah, you got a couple of men boarded Board certified, you remember the word from Monday? Board certified, the American Board of Obstetrics and Gynecology has examined these men. They've had 3 years residency and they're board certified. How about Monongalia County? Yeah, no question. University Med Center to begin with is 150 doctors, added into whatever Monongalia County had, right? The whole University Department of Obstetrics and Gynecology are distinguished obstetricians, gynecologists, and in addition, in the city is at least one firm of 3 obstetrician gynecologists, all of whom are trained, in fee-for-service. Now we come to Marion County. Suppose I was to say, do you think anybody here is board certified in obstetrics and gynecology? Do you believe that? You gave me some names here.
Yeah.
Do you think, huh? Well, let me hear it. What you said. I want you. No, don't feel it. Do you think he might be right? Because we're going to talk. Let's talk. You think he might be board certified? I can only tell you what the directory says. See, I can only tell you what I know. Okay. After all, you're entitled to good care, right? A physician would know how to measure it. A nurse might know how to measure it. Other people would know how to look it up in the directory. Why secrets? That's what the directory is published for. There is nobody. There never has been in OBGYN in the board certified in Marion County unless they were at the clinic. You clear on that? And when I tell you that today we would not allow our switchboard operator at the clinic, if a woman called up and said, I would like an appointment with an obstetrician, she is instructed to say, we do not have an obstetrician. We have had one, follow me? We do not have an obstetrician, but if you would like Dr. Connor to deliver you, he's a general practitioner who will deliver you. Do you understand what an answer is? Is that misleading the woman, do you think? But it takes a meeting of consumers like you people and of doctors to arrive at an answer to that question that's honest. So if you're dishonest in this business, you're hiding it from people, right? Now I'll go a step further. Suppose I said there's nobody board certified. And so far as people like myself in the business of medical care organization know, there is nobody that the American Board of Obstetrics and Gynecology would permit in this county to sit for examination. They lack the training necessary. Do you understand? This is serious, isn't it? This means we do not have, and I'm singling out one field, this is true. Didn't we discover Monday? Suppose you got something wrong with your ears, with your nose, with your throat. Do we have an ear, nose, and throat man in this county? Huh? No, you have to leave this county. All I'm saying is, do we have someone that will deliver you here? Yes, but he's not a trained obstetrician. Now, what's the consequence of this? Let's talk. Now, is somebody here partially trained? Right, that's a good question. Now, I think you're saying, is so-and-so, still trained. Are any of these men partially trained? Yes. You understand? They started a 3-year program and they quit after 1 year. What do we, at the clinic, or at the University Med Center, how is that handled? You call them a general practitioner with extra training. You understand the difference? Hey, we have this all the time. We don't go around saying that Dr. Connor is a surgeon. He has 1 year of surgical residency, 1 year of orthopedic residency, but not enough. You follow me? For the experts in his field to say he's fully trained. We have partially trained OB-GYN. Now, let me ask you if the second set of facts could be connected. The people who run medical care statistics know certain things. There is a rate in maternal deaths. I'm sure your speaker just now is much more familiar with this one I am. There's a rate of maternal deaths. In other words, you're not supposed to lose a mother, but one in, you understand? It's just very rare nowadays. How was it 100 years ago? Very bad, right? You remember the people dreaded. How many women really dread childbearing today? It's no longer, a case of facing death. You face death maybe like a freak accident. You see what I mean? It's a very low rate, except in Africa, Asia, South America, places where they lack doctors, where they lack trained specialists,
Well,
where they
after
lack
I've
good
seen the way they deliver some of the babies in Fairmont General, I sure do really children want to be up there.
All right, but
I've seen them in
now let's talk about this. You see, do you think this could be connected? In the last 8 years at Fairmont General, in 8 years, there have been 3 maternal deaths, and the number of women delivered each year averages about 1,000 to 1,100, so that we have an ability to say that there's under 10,000 deliveries. And we have had in at least 5 top-quality OBGYN specialists from around the country to look at this situation. Men who have, say, been in a service that they say delivers 10,000 babies a year and has not lost a baby in, since, say, 1958. You see what I mean? At 10,000 a year. This is all we've delivered in less than 10,000 in 8 years. Now, you think just poor people get hurt?
No,
Well, you think poor people, you ought to be concerned. Because poor people can get more hurt. You know that, from malnutrition on problems. Do you all remember one of the most distinguished wives and mothers in this city, of a distinguished civic leader, not a poor person, was lost? Now this could happen anytime, right? But when the rate is adding up, if you went to the university hospital and asked, when did you last lose a mother? I don't think Mr. Staples, even with the most difficult cases they're getting, and they get more difficult cases than we do. See, we just have ordinary run-of cases, not like a university. An ordinary local hospital should not do this. Let me ask you one more thing. When a woman is delivering a baby, I don't want to use any technical words, there's a thing called drip. They can put her on drip, can't they? Well, what will drip do? Well, I don't know. You correct me if I'm wrong, Dr. Jones. It has something to do with timing the delivery, contracting the uterus. Okay, a drip is something that I understand from board-certified OBGYN men, chiefs of service. Walter Reed, who have visited here, and others have told me, under no circumstances should the physician leave, like return to his office and leave the mother, in this circumstance. Go back into private practice. You follow me? In the city of Fairmont, at Fairmont General Hospital, women are routinely put on drip. Routinely, for the convenience of the OBGYN man.
Yeah.
For instance, suppose the OBGYN man has never missed. Suppose he was to tell you, I've never missed a basketball game at Morgantown. That's interesting, isn't it?
Yeah.
So sometimes a baby's born on a Thursday night, right? And there's a game up there. Sometime Rod Hundley was playing, but there were 4 of them waiting for him here. What he's got to do then, you see, is get it done with drip, right? But he's got 64 people waiting to see him that afternoon in his office. So he's going to stay downtown at his office, right? And those women are going to be dripped. Now the nurse is not in a position, and she shouldn't be placed in the position, of determining a life and death issue which might arise for that mother under those circumstances, you see? In other words, you deserve his care. You're paying for his care. He professionally owes you this. Now, we've been over a little bit of territory. And a lot of it sounds pretty ugly, scandalous, and actually the true picture is much more heartening. You have to sort of get mad in order to know where you're going. And then you have to understand what you're not allowed to know, what lies behind the scenes. What is the most important new developments in medicine? To my mind, they're the fact that young doctors of the 60s, it wasn't true in the 50s. I was recruiting then, in the early 60s I didn't see it. That young doctors in med school today are for the first time exhibiting a social conscience, a care for the poor. There's hope. A minority, not a majority, but a minority of AMA members are actually, and I'm not talking about the demonstrations, or stuff where they picket them and this kind of thing. There's a bigger element of disgust. More doctors are going on salary. Who can you get a salary with? VA, right? Go to a VA hospital. Can't you go to West Virginia University? Yeah, you can go to any university in the country. These are all general things. Government, group practice. More and more, you see. And these kids, many of them, want to go this way. Now, this is hope. They're not a majority, but they weren't there 10 years ago. Just believe me, they weren't there 10 years ago. And if it weren't for these doctors with a conscience, we wouldn't stand a chance. All of our anger in the world would be wasted, you follow me? What's the use of being angry at crooks or being angry at this or that if you don't have the way to change it? Now, what are the means of change here? In other words, the things that are wrong in Fairmont, where are they happening? What is the doctor practicing in a VA hospital? Is that why it's going wrong? Do we condemn the VA hospital at Clarksburg? Has anything gone wrong there? I mean, are they going to cut out your appendix when they didn't need it to make money? Is it going to happen at WVU? Huh? In what? Oh, boy, you know more than the med students do. Let me just tell you again. Solo practice.
One of the biggest doctors in Morgantown wanted to take my leg off. And he said it had to be done. And you see, I still got my legs, I'm still walking on them. That happened when... 42.
Was
That's
this
a
following a
doctor
mine
pick.
accident or something?
Yeah. Dr. Fisher. He
Well-
said I had to have that.
All right. We're not arguing with the university, are we? With nothing. Are you a bit afraid to go to the university? Would you be afraid that they'd cut it off that didn't need to come off? Does a doctor up at the university get money in his pocket?
No.
See, they've removed this. They've done two things. Watch what they've done. If you remove the dollar sign, that's one thing, right? That's good. Erase it. See, put it there, and then let's wipe it out. What's the other thing they do? When a student is coming up in medicine, he's observed. You know what's wonderful is to be observed. One carpenter on a construction project watches the other. The other guy, if he's a bum, is a little ashamed to take a 2x4 studding and put one nail at the top and one at the bottom if the buddy on the other side is knocking 7 in to hold that to the stud. You follow me? It's not just the boss, it's the observation, isn't it? What's wonderful about a med student is he has to not only learn by apprenticeship, but these are real professional people. They're not working people. And there's a certain shame that creeps into it. In other words, if the man was a student who recommended that, two other guys, man, what do you recommend taking his leg off? But if the guy's in his office alone, is he observed? No. There's no observation. You get it, huh? So we want observation and we want to remove money, don't we? We want other things, but would that help? Isn't that why we're not afraid of these places? Now, can every town have a VA hospital?
No.
All right. Can every city have a VA hospital?
No.
It's not possible. Can every city have a university? No. We must actually oppose. We must oppose, if we're intelligent, Marshall University wanting another medical school, like they sometimes propose down there. Because West Virginia is so poor, we must put all of our resources into Morgantown. You understand? We can only have one good school in this state for now, unless things get better. What is the answer then?
We have to watch.
Well, wait a minute. What's wrong with the VA to begin with? If you not only can't get them, there's something wrong. Look at the women I'm looking at here. Not everybody can get in, right?
That's right.
You got to be a veteran, and then there's hardly any, and then the males that aren't veterans can't get in, see? So, we want open, right? We want place without dollars with the doctors, observed doctors, open, right? What you mean is, when you remove the dollar for the doctor, make it open to everybody. Don't limit, right? We got a word for that, is if you can't afford to pay your bills afterward. Do you remember the word we talked about Monday?
Insurance.
Yeah, and if you don't pay afterwards, then you put something in front of paying. Do you remember that word? Yeah, who said it? Yeah, prepayment. Okay. You want to have prepaid care. You want to be able to pay so many dollars a month and don't tell me how much I owe you afterwards, doctor, right? Remember what I told you? The Chinese, before the communist thing and all, I don't know what the communists obviously done, but the Chinese used to pay their doctors, they tell me, I've never been there, only when they were well. The minute they got sick, you stopped paying them. I like that. I like that very much. That doesn't make sense. You stop paying them. His job is to keep you well. I mean, what a beautiful thing if every doctor was taught this, right? You keep these people well, and you'll live well, right? And when they get sick, you're going to be in trouble, okay? Now, of course, I don't know how they figured this out of their wisdom. If there was a plague, it'd be bad too, because everybody would be poor, so you'd be poor with them. I guess it works out. But we have the opposite system. When you're sick, when you're hard up, when you're without money, that's when the doctor bill hits you. Yeah, that's when it does. You don't think a doctor ever owned a farm anywhere, do you? You don't think doctors have said to this nice old man when he finished surgery before Medicare, now, John, you owe me $2,400 here. And he said, but I don't have it, Doc. You know, I retired on a farm. Yeah, but that North 40 acres of yours that's along that highway, it is many a deed. You go look at it down at the courthouse. Many a deed by which you get, you know, the blood comes out of a turnip sometimes, no matter what the saying is. Okay? We want prepaid care. Now, what's one other thing? You told me this is no good, right? A doctor by himself is not observed, and how does he bill the public? What system did he use to bill you? What does he charge you? He doesn't charge you a fee. So he's solo and fee. Is this a good system?
No.
All right, if this is a bad system, if he's going to cut out your wife's uterus so you can never have a baby again, or do what they say as a joke around the hospital, whittle on a woman. See, you whittle on a woman. You're 64, you take out one ovary. Don't matter whether it had to come out then. 65, you might take the other. 66, you do a D&C. I don't know whether, you know, I may have it out of order how it has to be done. 67, you do a partial hysterectomy. 68, you do. That's a lot better than getting $300 for that by itself, because you done made that uterus worth $1,200, okay? Big joke. Oh, they just sit there and they laugh about that. Follow me? Okay. Now, we don't want that. That's what does it, right here, right? Not every doctor, remember, we're not condemning, not every solo doctor's a crook, not every solo doctor does bad care. I will lead you to solo doctors who charge fees, who are fair men, who are devoted men, and who stand up and keep good records in their office and don't just, you know, do unnecessary surgery or anything else. But the system, it has built into it, right? No observation, they're alone, and fees. Now, how do we know it's a bad system in one other way? Let me give you an example. At the clinic, we have become the repository for deceased doctors' records. When the first guy died, you know, they didn't like the group practice originally, you know, in the 50s. But when the first guy died after we got started in the late 50s, his wife called me and said, you know, I've spent 6 months. What am I to do? I want to close the office, but it isn't fair. Who will take care of the records? I've collected all I can of his bills. I'll turn the rest over. But what of his records? Most of the patients have called for them. What if the others need the record, right, to go with you somewhere to another doctor? And what we agreed to do was we would take the records and hold them. And we do so. And it costs us money then, you know, to maintain them and alphabetize them and deliver them to people who come in later and say they're going to Ohio, you see, and they need their record, okay? But it's given us a beautiful view, like a university has, or like an insurance company has. It tells us how a doctor keeps his records. And it's real interesting to see what a doctor's record looks like. See, your name's up here, your address, and where you work, and your insurance. And it's a little card. And we see this one after another, and it's becoming so I can almost tell you what the next guys will look like. And then there's a date. Very poor stuff, no dictation, nobody else could read it. And then about this much comes in, complains about this. Then right over here, $6, okay? Then right over here, injection, $7, something else, $2, see? Real records. This is the medical part. It's all in one. This is the medical part. This is the dollar part. The dollar part in almost every case is equal in the number of words to the other. What do you do when you put them in a group? What do you do when you end this? Wipe it out. What do you do with honest doctors who want to practice good medicine?
Put them in group practice.
All right, you put them in a group. That's the most important thing. The group gives you observation. They watch one another. Dr. A today, looking at you at 9:30 tonight on the evening service, even though he's busy and he's got someone else, he's going to write out everything he sees, everything he hears, everything he can remember about it pretty well, because tomorrow morning somebody else is going to look at that record and say, "What the hell's the matter with you, Charlie? You didn't even order an x-ray." See, observation's just beautiful. You understand it? If your wife observes you, just admit it. Or your husband observes you, you rise to a little higher level. Haven't you ever seen a person living alone? Sometimes they collect all the newspapers without throwing them away, right? You get in the shack, you can't open the door. When you're alone, it's very bad business, right? Like observation. Do they not get paid well, or do we mean we're removing the dollar incentive from fee service? No, the group is going to pay very good salaries and fringe benefits. But is that better for you to have them on salary? You think it is? Could you prove it? Why is it better for you as a patient to have them on salary in place of fees?
Because they know that they will give you more care as a group than they would had you.
Now it might work the other way. The guy with a fee might want to make the fee higher and might give you more service, so that won't prove it alone.
Well, they know that this must be the very best service they have. First of all, they are observed, and second of all, their money remains the same.
The money is the same. Now watch this. It could lead to a worse service. Let's be honest. Why? The man's got his salary, unless his buddies throw him out, he could slough you off, right? But let's take surgery. That's where the life and death is, isn't it? He's going to decide whether to cut or not. Suppose his salary is the same, all he gets is an annual raise, better fringe benefits, pension. Is he going to cut you the way the experts show there's unnecessary surgery if there's nothing in it for him?
No.
You see, at some important points, this is decisive. The money usually cuts this out. What it won't do is guarantee the point you were getting at. You see, it won't guarantee that. Observation will. Get it? The money cut, not the money. Well, observation will. Prepayment helps. Why? When he comes in, should he be wondering whether to order a blood test or an x-ray on you based on what you make?
No.
See, isn't it better if it's paid for?
Right.
How often does a doctor have to say, "Lady, I hate to order all this or write all these prescriptions. You may not have enough money." Yet you need the thing, right? All right, so we need group practice. We need prepayment. Anything else we need? We need continuous care. Because up to now, you ever heard of Mayo Clinic? Mayo Clinic is a group. But what's missing? The Texas rancher flies up from Texas. He spends 3 days getting diagnosed and he flies back to Texas. The king flies up from Siam. They get diagnosed. It's a famous diagnostic clinic. Is that what you want? A diagnostic? You want continuous care. You with it? You want to know that tonight somebody will take care of you. Tomorrow. That'll go on and on. You follow me? You've got to know you've got a family doctor and you have the team of experts. Now, what other things do you think are important in what you learned this week? I haven't been with you, so a good part of it. But what? Huh?
Education.
Health education. You think that's been really good and rounded?
Yes, I think so.
Cooperation.
Well, just look at these things. You see, your name is, I don't know much about your organization, but health is in its right? Is health education important? Terribly important. If you all go in for a low-income people's group of some kind or health care program, don't forget to put this in, right? Don't forget that. Keep it up. You need it desperately. Some of the people have to constantly be reminded of the aspects of this kind of thing. We all need to learn all the latest developments in it. You've learned, you think, something of cooperation. Do you think you could cooperate together to get better health care here? Could you? Could you work together? I mean, you have different points of view, but will you be able to get along with each other?
We have.
You've had your arguments here, haven't you? But do you think you could cooperate for these goals that we've been talking about? What else are you going to? What have you learned you need? You're going to need money. Can you do any of this without money? Suppose somebody dreamed up a med center. Could we have had the med center if the legislature hadn't set aside $30 million and it would now take probably $50 million just to build the buildings? Could the clinic have come into being if there hadn't been somebody with the lettuce to start a group practice? You see, it can later get a way of going, but you need money. But there's something else you need here. All right. I know those are your new words. I'll put down organization, okay? Organization gives you power, doesn't it? You must organize. You must organize. You take each banana off of the bunch, and each one can get skinned alone, right? Let's take a bunch of bees. Nobody messes with a bunch of bees. That's a beehive is organized. You start messing with it, they're all down, right? Nobody is afraid of one by one, right? The only time you're worth a darn is when you're like this. The only way. I mean, you understand that the people who have the money don't have to talk about this. They don't need this course, do they? I mean, they're already organized. I mean, you've heard of Fairmont Field Club? Yeah. Very well organized. Very well organized. Organized well enough to control Marion County, to control the city of Fairmont, to control Fairmont General Hospital, and to have an alliance with the medical society, and to do anything else it wants to do. They don't have to talk about it as they drink their cocktails in the evening, right? Without any Catholics allowed to be present, any Jews, any Negroes, anyone who has third-generation descent from an Italian, from a Slovak, from a Ukrainian, from a Czech, from a Russian, etc. Okay, and it goes on for several lines. That's their bylaws. And they sit there and they're very well organized. Did you imagine that Consolidation Coal isn't organized? Anybody think they're just one by one? I mean, what makes it so hard to get the coal miners in West Virginia like loan legislation? What makes that so hard politically? Why do we have to, I mean, we can send a man to the moon. Why can't we agree that when the man is breathless after 50 years underground, that we don't need any more doctor studies? You understand? It's past that. It's time for a political decision. Because the doctors argued bronchitis up to 10 years ago. And they still argue whether there's a disease entity in the English or the foreigners in Europe. Have always had to teach the Americans these issues. All we got's the techniques. But on every basic come-down issue, from pneumoconiosis, which is black lung, we've had to get it from Wales, or get it from England, or get it from somewhere abroad. See? Now, why can't we pass black lung laws to help the breathless coal miners? Do you think anybody's against it? Okay. They're organized. Now, do you want what we talked about this week? It's going to take in order. Is it going to take in order? Not this first, right? What's first? No question in my mind. I'm not your leader. But there's no question in my mind, if I wish you Godspeed, you better begin here. You better know that you organize and you stick together and you give it the time and the love that you give a child in nurture. You know, you give to your organization so that Congressman Mollahan and Senator Byrd and Senator Randolph respect you, so that the city directors of Claremont and the county court respect you, and you'll be able to get money. And this is really part of this. You can't organize if you don't learn to cooperate together. Am I right? And then you'll get health education and all the stuff we put up here first. Group practice, prepayment, right? You want all those things. Now, what do you want to tell me?
If group practice is the best with doctors or anyone else, why don't those doctors from a general hospital like to work with doctors at the clinic?
Very good. Very good. Very good question. You all got the question? Very good question. We must deal with it. If group practice is good, then why don't all the doctors get into it, is one question. Secondly, if they're not in it, why don't they cooperate with it?
They don't.
They don't. They don't cooperate, do they?
They'll try to run it down if they can.
They try to run it down if they can. Now, why is this? How do you explain? I want you all to discuss.
Because you're messing with their pockets.
All right, okay. Some of them are it's fear, right? Is fear part of it? Suppose you owned a little grocery store, and suppose they announced an A&P store is going to come in right next to it in Bellevue. Do you like it? Do you see what I mean? It's a normal fear, isn't it? It's an understandable fear. It could be a fear around money, but that's not all. Suppose you've been calling yourself a specialist in big diseases, okay? That's what you've been calling yourself. Suppose the group practice is going to come in and say, when we say a specialist in child diseases, it's going to be a board-certified pediatrician. Huh? Now your pride, right? Right? You fear it's going to cut your pride. Now, you follow me? Suppose the group brings 2 big board-certified OB-GYN men to this town. Board-certified. Does that make the guys who are... You know, you drive down the street, you'll see the sign out there.
Yeah.
There's nothing wrong. The man has a lot of practice. He delivers a lot of such cases. You follow me? The point is, it's pride involved. So fear can be involved based on these things. Now, if dollars are involved, I think there's no question you have to realize that just pure plain greed is involved. In other words, you've got it now your way. You've got control your way. Of what? The medical society? The hospital? Right? You got it all. The community, you name it. So they fear. Sometimes it's greed. Sometimes they fear loss of control. Isn't that what they're fearing? We could have this under there if you want to use fear. You know, you understand human emotions, so it's sort of bound together. But do you see the point I'm making? Suppose age is involved. You know, you're looking at a man with some gray hairs, so some of you that are almost as old as me won't mind me saying that it must hurt a little to see a group bringing in 31, 29, 32-year-old doctors when the average age in Marion County is something like 56 years old. You know what I mean? It's like saying, here's the best, nobody likes to see that. Is that right? I mean, these guys brings modern science. I mean, we see that. Dr. Hunter's been here for 10 years. Dr. Koppel's been here for 12 years. Don't you think when we brought Dr. Joe Masog here last year, that he didn't teach them a few tricks? Yeah, but they're in a group and they don't mind learning. How do you think the old pediatrician feels up at the hospital when 2 young pediatricians arrive who say that isn't the right way to do that, and that's not how you do a transfusion? I mean, 12 years have changed, haven't they? And you want the latest things. I mean, Dr. Hunter came to me the other day to say, we better get all the internal medicine specialists together because the only guy that really knows all that electronic gear up at the hospital is Dr. Masog. He just got here out of training, see? Well, these are serious issues, aren't they? They can't keep up with everything, but in a group they can quickly learn. When you're on the outside, don't you fear that really? I mean, it's learning. None of us like to see it change, you know? I imagine even a woman who likes old-fashioned ways of cooking would sort of stand back and watch somebody that took a laser beam, you know, and had a pie ready, you know, in 30 seconds. I don't know what they're going to do next year. You know, you wonder. I don't know what they're doing, you know, and it's all so new. Is this any helpful? It seems to me, what do you want to do? It's a better way, but they're too old to switch. They're afraid of it. In other words, I would love to say I could take the Marion County doctors and mold them into a group. If you did, you know what kind of group it would be? The other group was non-profit. And the only kind now would be what we talked about at Paramount Emergency. They might form a proprietary or a profit group to take over something. You follow me? Yeah, you might get them together to split the profits. You see what I mean? They might come together on those grounds. That would be the only grounds I can see. Do you all see it differently, or tell me? Because how do you change the ones that are already here? It's pretty tough. They're not that young. They're not that interested in... They're set in their ways. Now, does that mean, in answer to this lady from Grantown, where you're from out there, Baxter? Oh, you told me Grantown when you mentioned Grantown the other day. Where are you? Grantown, okay. The lady from Grantown. Does that mean that there aren't other solutions? That the young doctors in med school don't want to join the group? No. You see, the younger ones are easier to get. We got the West Virginia angle. Now, how are we going to go get the money? You want to talk about that? What's it going to take? We said first, down here.
Cooperation.
Organization and cooperation, right? And if you do that, where is the money, do you think? Is it in Marion County? Enough of it? Some. Yeah, that's a good answer. Some of it. Well, where do we have to look to get it? Federal government, and some of it might be state of Charleston. And then if both of them said to us, can you match it? Then it would take all of our wits to figure out how to match it, right? If they said, we'll give you $1 million, the state will give you $500,000 if you can raise $150,000. You see what I'm getting at? Now, that does it mean bake sales? Yeah, but it means using our wits together in much other ways than, you know, just that kind of way of approaching that kind of money. You may have to, it's one of the reasons that you'd approach other non-profit boards and organizations. It's a reason you want to develop your relationships with all kind of people, you know, in this county, organized labor and other groups, and keep good relationships, you know. Isn't that true? There are good people who might be able to help out then. Some local give you a $10,000 loan from its treasury. It'll come back out of the third year or something. See? There's a lot of ways of doing it. We got to do it.
Good medical care around here.
Well, I don't know any other way, or I'd recommend it to you. Do you all know of another way? Is there any way we could get it without taking a drastic step to organize? I don't know of any easy way. If there was an easy way, is this going to be a hard way? It's going to take a lot of effort. Effort's a good word. A lot of effort. Yes, ma'am.
Where are we going to get all these new doctors, though, on a salary basis if they're all wanting lots of money?
Okay. Well, let me just say, it is possible, despite this is a very important heartland question. You can't do it even if you get the money if you can't recruit the doctors. I visit down at Beckley. I visited Bel Air, Ohio, and the literature you've been given this week, I think, it mentions both these places as getting OEO money. They've been able to get a group together of salaried doctors here. They had a group, just like the clinic, you know, here is in Fairmont, and they were able to add on to it. You understand? To take care of the people. You see what I mean? Now, was it easy? No. Does it mean you need skilled people? You can't be expected to devise that program. You follow me? You know, how can you come up out of the top of your head with a figure for a salary, or what a fringe benefit is, or how you get a medical director, you see, to lead them and all? This requires people that are in the business, like myself. That's why you make connections. Now, it is possible, in other words, if you get a good salary and excellent fringe benefits. Very important to a doctor. Why? Because when you pay a lot of taxes, you don't want to pay taxes on all your money. So you tell them, look, we're going to have big pensions, big time off. How much time off do you think the doctors at the clinic get? Well, they're close. We give them after the first year, which it's a complicated formula for the first year. After the first year, 3 weeks vacation a year, 2 weeks study time a year. They're drawing their salary while they go and study. See, is that good for you all? Sure.
Yes.
They're studying the latest in medicine. But where does he study? You ought to know doctors well enough. They study in Hawaii, in New Orleans, in New York, Miami Beach. They go where the AMA. No, they don't go close for the most
Well,
part.
how come they took doctors? Well,
Oh, no, I'm going to tell you that in a minute. No, you've got a different point. You give them time off, see? Now, what else do you give them? You give them a faculty affiliation. That's this lady's point. Every one of our specialists goes to Morgantown 1 day a week and is a professor there.
No, this one has taken him away from the clinic and he's still going.
Who, Dr. Gardner in surgery?
No,
Someone that's going over there every week?
oh, he's been going at least 2 or 3 years.
Mr. Robson, Dr. Gordon down in Morgantown.
Yeah, Dr. Gardner went there for a whole year, so that now he's the only surgeon in Marion County who is a fully trained man to remove your lung if you get lung cancer. You don't have to leave, be away from your family. He can, if you need peripheral vascular, you understand, you're about to lose this arm or this leg because right in here the artery's clogged up, but otherwise your heart's all right. He can go into you, remove the artery, replace it with a plastic artery, and your leg goes on. He's the only man does this kind of what could be called heart surgery, but he won't open your heart. Follow me? That's too complicated. He can do it, but the hospital at Fairmont can't handle it. You follow me? Now, do they go away for that? Yeah. Do you get good men? Yeah, you're asking me, am I answering your question, graduate? Some doctors want all this. They say, I'll take less money if I can be a professor, if I can have time off with my family, if I can have a faculty affiliation, if I can have a pension, if I can have life insurance. Does he have to buy his life insurance? Only if he wants more. We pay for a lot of it. See? It's like working for General Motors. You understand? Not a working man in blue, but the president of General Motors. You give him a lot of fringe benefits. See, to keep him happy? We like the salary principle, though. See, he gets all this, but we say, yeah, but we won't pay you to do surgery, doctor. Surgery we won't pay you for. That you must do. If you need to do 10 operations today, do 10. If you don't have to do any this week, that's fine with us. You didn't have to cut anybody unnecessarily.
When Mr. Gordon do this surgery, in Morgantown, well, if you have a patient for lung cancer or this leg concern, Morgantown is where you have to go for him?
Oh, no. He can do your lung here, and he can do peripheral vascular work, the veins and arteries here, but he would not open your heart here. Okay, he does that in Fairmont General. The lung he can remove in Fairmont General. If he thinks it has to go to Morgantown, it'll go to Morgantown. He won't do anything here that scientifically should not be done here, see? But if that beginning to answer your question, you get them with good salaries. You don't try to pay them, what you pay a working
It
man.
sounded like it might be a lot different in how much money they would take in,
Yeah.
what they're
No, let me put it to you this way. If you're very shrewd. You make the salary plus the fringes almost what that kind of man can do outside. You follow me? Almost, but you don't go as high. And you keep the principles to protect your people. You understand? You're keeping them salary so that he doesn't want to, I want to cut somebody to, make. They never say it, but, so he won't be encouraged to do it.
At the clinic, if your doctor there said a person needed an operation, do your doctor there do the operation? Or
Well, they don't do it in the clinic. They do it at Fairmont General.
They have to.
Fairmont Clinic puts all its patients in surgery and its bed patients at Fairmont General. Okay? We don't go to emergency. And then, whenever they need to, they refer you. For instance, our plastic surgeon, if your face went through a windshield or removal of a long nose or something, you follow me short, and all this plastic surgery we do in Pittsburgh, most work we do refer to Morgantown. Did you have a good session on drugs this week? Pharmacy? Huh? Did you feel you had a good discussion?
How long has Dr. Jones been at the clinic?
About 4 years.
Well, that's when this other one left.
Dr. Pye.
That's right.
Yeah.
He was a very good doctor.
Right, and he went and studied radiology. You know what we talked about here, X-ray, he's become an X-ray doctor. He went away and took 4 years training. The Fairmont Clinic is both fee-for-service and insurance and prepayment combined. In other words, for many of the people here, they would only see us in this fee-for-service image. We discussed this on Monday. Our problem is we won't even be able to keep our doors open if we don't collect fees because we don't have prepayment. You follow me, for everybody? That's our insurance prepayment, don't you? Many of you are over 65 and have Medicare. Now, the minute you have Medicare, you're in good shape. If you have Medicare plus Department of Welfare, you're pretty well insured. You see, in coming like to a place like the clinic, you know, to get total care. If you have Medicare without it, you've got some
UMWA?
pickup. And then UMWA, I was leaving out because it is the biggest single block of patients that have the best insurance around here. You know, the welfare fund beneficiaries of the UMWA. But many of you have encountered, as we talked about on Monday, not only at the hospital but at the clinic, the question of pay. Like this, right? Pay. People want to know, where is the money, you know? And that's the reason you're going to face it until you get a program that is paying the kind of thing. Yeah. Well, I think you want to organize. You want to draft a program. Okay? What does it mean to draft a program? You're going to have to put forward a proposal. I mean, there's no use organizing and not going anywhere. You're going to have to get a proposal together that proposes what you want. We talked about it maybe having two components. You remember that on Monday? One would be possibly the heat people. That's the ones you're organizing. They would have outreach. That means going out into Joetown and Norway and Grantown, all these places. They'd have, whatever you call them, health advocates, and they would take on a new job that's expensive called transportation, right? No good without transportation. You get good services, but how do you get the people to them from the country? Now, on the other side, we got an organization called MBA, which is the non-profit side of the clinic, the one that if you ever get a pharmacy prescription, it says in little letters MBA clinic. That's to show you it doesn't belong to the doctors, it belongs to the people, see, that are on the board, the community. Follow me? All right, now look how this could be a marriage. You follow me? They would agree to handle the medical program. That would mean what? What we showed you in Belair, plus. Have to add doctors, right, to do it? Might have to add a building. Might really have to add a building to pull it off. Home health services, right? Show you how to have nurses who go out in the country and go out and take care of you. With this program would have to pay the hospital when you go in the hospital, pay WVU when you're sent over there, pay for any specialists. In other words, it's no longer your headache at the money. Then what would happen? Money from Washington, money from Charleston, maybe local, would be coming into a kitty and funneling down. Or the government might say, we don't like it like that. We want it to go, one set go to them for their expenses, right? One set that way. We don't know. We haven't met with them. But if you're interested, and I think that's what your Trans-Century Team people who are working here are trying to accomplish, if we work together, it is very possible that a federal grant could be secured for Marion County called an experiment. In In other words, we don't know whether it would work or not, but why not find out? The old system isn't working. They go put $10 million into some city somewhere, they don't know whether it'll work or not. They're doing every kind of experiment, but Marion County's being bypassed, right? And after all, we got a lot going. You guys formed HEAT. That's pretty unusual, isn't it? The organization you've got here for little people. And we got a pretty unusual thing. Didn't we figure that out at first? Boxburg hasn't got it. State Capitol hasn't got a group practice. State Capitol hasn't got a big home health service. You see all the things that we got here to start with? Now why not get them married? You see what I mean? And get a proposal in to get money for this whole thing. Does it make sense?
Yes, sir.
You got to be, you're going to have to give it time, effort, as somebody said, or we're not going to bail it out. But are you beginning to get the picture? This could be a proposal that could be taken very seriously in Washington, because they might say this will solve the problem of how the Medicare is being gouged, so Social Security is almost going bankrupt, paying these big bills. Here the bills won't be big, they'll just be whatever's necessary. You'll prepay in advance so many dollars a month, and you won't be faced with some doctor wanting $1,500 for one operation.
What would be a logical fee per person for their personal part of
It's difficult to answer you.
I mean, for the patient
Let me-
to pay their insurance.
Yeah, I see what you're saying. Now, let me just put it to you this way. If the federal government puts up big money, that'll be the substantial part of the money. Suppose a person who was not, this would be for whom? The poor. All this is for the poor. We're not going to come along and do this for some well-to-do person.
Someone mentioned the figure of $50. Well, that would be outrageous for the ordinary
No,
person.
but you're so right, but may I show you what we mean? Let me just show you what we mean. It might cost the government $50 a family. It's possible that it would cost as much as $50 per family per month to do what? Have we quit listening to things here we're going to do for this? No. We're going to have medical social workers. Now, is that a girl down at the Department of Welfare? Oh, that's a totally different kind of person. That's a person that when your teenager's in trouble, need somebody to talk to. When a family is husband and wife, banging each other around and arguing. You see what I mean? Counseling, all this kind of thing. We haven't even put down here free drugs, have we? See? You see why the cost is high? For a family may come in, a father, a mother, and 8 children, huh? That's quite a bunch of people to go through pediatrics, immunize all the children, take care of them when they get ill, give them a night service, give them a hospital service, give them a home health service, send them to Morgantown when they need it, pay all of these bills. Do you understand what I mean? It sounds big, but some poor people are already paying $600 a year without knowing it. The drugstore grabs $24 here, $19 there. You add up sometime the way it dribbles out. It's that you don't think of it this way in prepayment terms. Now, for a poor person, we would say to the government, why don't you start out taking the tab? They may say, well, we won't take it all. I'm talking out loud the way they might answer. They might say, we won't take it all, but we'll agree to see that much money is put in if you will collect Medicare on the over 65, if you'll collect Department of Welfare money on the indigent categories. You see what I'm getting at? And if that kind of money on the average came to, $18, you see what I mean? Not all the people would be in those categories. Then we'd pick up the tab for $32. You see? They might answer it that way. Or there's a lot of ways you can skin a cat without choking it to death or choking it on creamery butter. Can you see how you could work a proposal out? Huh? Do you begin to now? Let's say we start this, and our board says that's fine for the poor people, but we're not going to bar the working people and the rich people. Suppose our MBA board says that, which they might well do. I don't know whether they'd say that. See? Now along comes Mr. Well-to-do. He says, I hear you got the best doctors around here. I hear you got free drugs. I'm tired of my insurance programs. I'm tired of the whole shooting match. What can I do about it? Well, we might say to him, I tell you, we've done this as a bargain rate. For you, we'll still leave it low. We'll establish the rate of $55 a month for family units that want to sign up. Now, could we afford to sign him up by himself? No. There's a rule. It's got to be a group. Because the rule is called adverse selection. That's terrible words. It means every guy who thinks he's getting cancer or a heart attack, he comes running down to sign up. See? So you don't want him. You want him to say, hey, what do you got, a machine shop with 35 workers? You give us the whole machine shop at this price, and we'll take the whole shooting match. You follow me? Because otherwise, the only guy who come down there will have 14 children and a wife that's pregnant, right? I mean, you know, and he's ready to sign up. I got too many bills. What do I do? And he'll leave the single guy, you know, walking around, see? Now, would there be a different rate for a single? It sure would. Be a different single rate. We're talking about a family unit. Husband, wife, or husband, wife, and children, you know. At the beginning of the week, it was fuzzy, wasn't it? Yeah. Is it like a jigsaw puzzle, the parts of it? You don't see them all yet, but you can almost see a picture on the table, but you can't quite see it. Is that the way it's getting? Is that fair?
With the family group, wouldn't it differ in price according to the size of the family?
Yeah, you might have single, you might have a couple rate, and you might have a family rate. You might break the family rate down and have a family up to 5, a family up to 8, a family up to 12. You see, you can't sit here and do all of that, because if you're dealing with the government, they're going to be answering at all these stages the way they want it. They may say we want what they call a flat per capita rate. In other words, never mind telling us a family, break it down per person and we'll multiply it out. We got 14 in the family, we'll pay you 14 times the rate. We got one, you see what I mean? They may want it that way. All we can do is come in and approximate. We don't know that we can do it for that. Say that when you're giving everybody all their surgery, all their drugs, all their doctor visits, all their injections, all their social work, all their home health visits, it's not cheap. You see what I mean? There's no use pretending that it's cheap. It's costly, but it's within reason. It's within reason. There's many families spend more than $600 a year, I'll guarantee you, for their surgery, for their hospital bills, for their doctor visits, and then they don't get all they want or all they need. I've taken very long here, Ms. Jones, so I'm going to thank you for listening to me so patiently and let you finish your weekly session here.
If we could all get together in different places and have some place to meet.
You've got trans-century people, you've got a whole team of 5 here that you ought to beat around. I'm not in your team, Bobby. I'm on the outside, but I'm very sympathetic to what you're doing. You know, you have leaflets for everybody who came here, and I'm trying to respond. You know, maybe some of the people who came, you told them you wanted lower pharmacy prices, they can't respond to you. They don't know how, but I'm telling you, we're ready to cooperate there. But you got to get organized, and you got to talk with your team about how do you do things, okay? And I meet with them periodically, so I'm in touch. But I don't want to interfere in the detail of your organization, okay? Thank you very much.
Let's give Mr. Ross a
Now, what he was trying to say in very simple words, okay? United States government no longer let him, I, or other people in our position sit down and say what's good for you, okay? So what we did this week was try to take you through a process to let you know the good and the bad that exists in this county, okay? To put you in the position where you can say what's good and what's bad. When I go to the senator and say, well, Senator Byrd, people in Marion County need prepaid medical services. Who are you speaking for? You know, you're not for. You know, that's what they tell me anymore, okay? So they no longer listen to me. They no longer listen to Mr. Ross. So we have to organize in order to speak out for ourselves. It will not be me meeting with Senator Mollaham anymore. It will be he. It will not be me meeting, I said Senator, Congressman Mollaham. It will not be me meeting with Senator Byrd and Senator Randolph anymore. It will be he. And the whole process this week was trying to educate you to what was going on in Marion County, how to talk to these people and tell them what you need and how to go about getting it. You understand what I mean? It wasn't to put anyone on the spot. We can no longer write proposals for HEAP organization. HEAP has to do it themselves. And this is why we came together for one purpose, in order that we may learn how to do things in which to make a change about the part that affects our lives the most. Mr. Ross maybe might say, yes, there's good practice over here that's good, you know. There's something else over there that's bad. But we, as sometimes, have worked with other providers in the community. We have asked them to come and participate in this program. Am I right or am I wrong? Did they come? But who in the medical profession came to participate in the program? They were out of town. They came from Montague County. Okay? They did not come. Okay, didn't we advertise it in the paper? Okay? Did anyone come to see what we were about? All right. So here's a man came, sure, might be something in there for him. You know? Might build that clinic to be a great big thing. I don't care how good it be, as long as we get good quality health services, right? Isn't this our purpose? Trying to get better quality of health services, okay? So we can't look down at that man and say, what's in his pocket, you know, at that angle. Somebody's going to plant it in his pocket. But we don't care what goes in his pocket as long as we're being taken care of. You understand what I mean? So this was one of the purpose of coming today, coming all week, to educate us about what was taking place with federal money in Montague and Marion County, okay? So now we have learned some of the things that take place, good and bad, okay? We had good doctors in here, good pharmacies, we had bad pharmacies, we had good pharmacies. Telling you what it should be, and it is. We had providers telling you what it should be. Some told you, some there it isn't, okay? So we had good and bad all week long, okay? Now don't take anybody's word, okay? For anything, I want you to be able to weigh it out on the table yourself, okay? So when we get back together again, okay, you can have some idea of what avenue that you want to take up. Do you think this is a good thing, the last diagram he showed out on the board for you? Or do you think you should save the Cook Hospital? Whatever it might be, whatever, emergency hospital. You can make your own decisions of what's good and what's bad. I'm not going to make them. TC's not going to make them for you. Transcentury's not going to make them for you. This is the object of organizing. So we can determine for what is good for us. You understand? And stop letting somebody at the book say that's good for poor people. Because you know yourself, it haven't worked so far, have it? What have you gotten out of it? I mean, if I'm wrong, say I'm wrong. The people really make the decisions on our lives. What have they did for us? Nothing at all. So we want to get ourselves together, organize, get some farm in which we can say what we need and what we think might be better for us. All right. So here we have come to the end of our program. Okay? I'd like to know, and this is the only way that I can tell, did we get anything out of the program or not? Okay? We invested a few dollars this week in this program to try to make a success, okay? And the United States government will ask us how much of success it was. We are from the government ourselves, okay? This is some of this, I'm telling the truth, this is some of the money which they pay us that they claim that they hand down to the poor. So anyway, they sent us in here to work with providers of service in the medical services to try to make a change, okay? So the 5 of us found out we cannot make that change. People have to make that change. So we're trying to do it by means of community organization, okay? And that's the only way that we can make a change in order to have power to do things, okay? So it's going to be left up to the heat group whether we get a change or not. TC is moving on. TC is a big company in Washington, D.C., Trans-Century, you know, and has a whole lot of contracts around the United States, okay? You know, trying to prove that there are some good things to be done, okay? And some good things can be done. I had an article from Toledo, Ohio, the other day, saying that they had got $40,000, okay, for a low-income hospital there. This is another site in which they have a Trans-Century team working on a government program just like ours. So if that's what we're aiming for, you know, I think this is what we should shoot for. Free paid medical services, okay? Wherever it might be. Just take your time, relax, you know, nobody gets scored here, you know? It's a very simple thing. Yes, sir. Look at my pocket, there's a whole... Mark your name at the top of the brain, okay? Mark yes and no. The first one says, do you think the elderly and low-income people have more health problems than the rich? Okay? That's the first one. It's either yes or no. Okay? Is the Framont Clinic a group practice or a solo practice? I didn't ask no one to answer out loud. Number 3, how can we get better health care? Ask for it as individuals, organize as a group. We can't get better health service. We give up completely. How many low-income people is there in Marion County? We have talked about low-income people and what the population might be all week long. Number 5, can you get food stamps if you're not on welfare? We talked about food stamps this week. Number 6, do all doctors treat people who have medical cards, welfare medical cards? Number 7, if a doctor gave you bad care, what should you do? Go home and sit down, not pay the bill, or go get a lawyer in school? Number 8, if a person's on welfare, can he get a free nurse on Medicare? Can he get a free nurse to come to his home? Number 9, do any poor people serve on the board of the Framont Hospital? Number 10, is your prepaid medical care a good way for poor people to get better health service? Number 11, is 25% of all surgery done by doctors not necessary? Number 12, if I hear somebody else answer out loud, I'm going to disqualify you. Number 12, what kind of practice would you prefer, group or solo? Number 13, who gives home health care and nurses? That's Framont Clinic, that's Family Service, and Department of Welfare. Number 14, do we have to work hard to get people, do we have to work hard to get people interested in heat and willing to join heat? Number 15, how much does welfare pay of your needs? Okay, on the back of the paper, I want a comment from each individual about this week's training. Whether the food was lousy, whether the trainers were bad, etc. What did you receive from this week's training program? Okay? I'm not going to get angry at anyone if you told me the food was bad, the babysitters wasn't no good, Barbara, you wasn't no good. I'm not going to get angry with a soul. I'll be just as sweet next week. Okay? And what did you get from the training? The speakers were bad. Say the speakers were bad. You know,